Hello people. Welcome to What Is. Have you ever come across someone who faints all of a sudden, on encountering loud noise, or in inappropriate situations? Or, do you experience such difficulty? If so, get to know that, in such situations a person actually doesn't faint, but instead they go into a deep state of drowsiness, or in other words they actually sleep. Let's explore in detail what it is. This is What Is Narcolepsy. Before moving on further, please click on the subscribe button, and also press the bell icon for further notification. I post every 2 days. So, coming back to narcolepsy. Narcolepsy is a neurological disorder that affects your ability to wake and sleep. People with narcolepsy have excessive, uncontrollable daytime sleepiness. They may also suddenly fall asleep at any time, during any type of activity, especially when they encounter situations that are shocking, and are hard to believe. Symptoms of narcolepsy. Narcolepsy is a rare long-term brain condition, that causes a person to suddenly fall asleep at inappropriate times. The brain is unable to regulate sleeping and waking patterns normally, which can result in excessive daytime sleepiness, feeling very drowsy throughout the day and finding it difficult to concentrate and stay awake. Sleep attacks, falling asleep suddenly and without warning. Cataplexy, temporary loss of muscle control resulting in weakness and possible collapse, often in response to emotions such as laughter and anger. Sleep paralysis, a temporary inability to move or speak when waking up or falling asleep. Excessive dreaming and waking in the night, dreams often come as you fall asleep or just before or during waking. Narcolepsy does not cause serious or long-term physical health problems, but it can have a significant impact on daily life and be difficult to cope with emotionally. But what causes narcolepsy? Narcolepsy is often caused by a lack of the brain chemical hypocretin, also known as orexin, which regulates wakefulness. The lack of hypocretin is thought to be caused by the immune system mistakenly attacking the cells that produce it or the receptors that allow it to work. Who's affected? Narcolepsy is a fairly rare condition. It's difficult to know exactly how many people have narcolepsy because many cases are thought to go unreported. Men and women are thought to be affected equally by narcolepsy, although some studies have suggested the condition may be more common in men. The symptoms of narcolepsy often begin during adolescence, although it's usually diagnosed between the ages of 20 and 40. Narcolepsy diagnosis. Symptoms of narcolepsy can look like those of other health problems. Your diagnosis might involve physical exam and medical history. Sleep records. Your doctor might ask you to keep track of your symptoms and when you're sleeping for a couple of weeks. Polysomnogram, PSG, this is done in a sleep disorder clinic or a sleep lab. It's an overnight test that takes constant measurements while you're asleep to record problems in your sleep cycle. Multiple sleep latency test, MSLT, this is also done at a special clinic or lab. The test takes place during the day to measure your tendency to fall asleep and find out whether certain elements of REM sleep happen at unusual times during the day. You'll take 4 or 5 short naps, usually 2 hours apart. Treating narcolepsy. There's currently no cure for narcolepsy, but making changes to improve your sleeping habits and taking medicine can help minimize the impact the condition has on your daily life. Taking frequent, brief naps evenly spaced throughout the day is one of the best ways to manage excessive daytime drowsiness. This may be difficult when you're at work or school, but a GP or specialist may be able to devise a sleep schedule that will help you get into a routine of taking naps. Keeping to a strict bedtime routine can also help, so you should go to bed at the same time each night whenever possible. If your symptoms are particularly troublesome, you may be prescribed medicine that can help reduce daytime sleepiness, prevent cataplexy attacks and improve your sleep at night. These medicines are usually taken as daily tablets, capsules or drinkable solutions. I wish to conclude this video on a positive note. Having narcolepsy is not a big deal to worry about. One with narcolepsy can easily overcome with practicing regular sleep schedule, and simple brain exercises. I hope you found this video really helpful. This was What Is Narcolepsy. Goodbye and let's meet again in another interesting video.